equipment operation, quality control, and radiation production. You will see that a lot of these categories are duplicated. We wanted to make sure that we covered all of the information in detail. Principles of radiation physics. X-ray production. We want to make sure you understand where the X-ray production is coming from. Target interactions. You may have interactions with the equipment, bodily functions. You may have a patient that has a disease that doesn't interact very well with radiation, and we're going to cover some of those diseases later. X-ray beam, photon interactions with matter. Radiographic equipment. We want to make sure you understand all the components of the equipment, which includes the X-ray generator, transformers, rectification system, image display, image acquisition and readout, quality control of radiographic equipment and accessories, limiting the beam, which is called beam restriction, recognition of malfunctions. We want to make sure that if your film does not come out suitable for the physician to have a clear view of the area in which he is examining, then we need to figure out why. And we're going to go through those steps in this program as well. Digital and film screen image receptor systems, those are processors. We want to make sure we cover the shielding in detail. Image production and evaluation. Selection of technical factors. Factors affecting radiographic quality. Once again, if you didn't get a good film production, we want to know why. Technique charts. Image receptors. Image processing and quality assurance. Film storage. We want to make sure that the film is stored in the proper containers as well as proper temperature and location. Cassette loading. We want to make sure that you do not stuff the film into the cassette because it will actually cause damage to your future shots. Image identification, automatic film processor, digital systems. We'll cover all of that shortly. Criteria for image evaluation. We're going to cover density, contrast, recorded detail, distortion, demonstration of analytical structures, such as positioning, two-part image receptor alignment, identification markers, patient considerations, and these are the conditions I was mentioning earlier. The pathologic conditions are the actual diseases we're going to cover that do affect the quality of your image. Also motion, and we'll go into that. Digital and film artifacts. Artifacts is junk. That's unnecessary stuff that winds up on the film. Film handling artifacts, static, pressure artifacts, grid lines, Mori effect, and aliasing. We're going to cover fog, noise, acceptable range of exposure, exposure indicator determination, gross exposure error, and image degradation. Radiographic procedures that we're going to cover. Now understand, if you are focused on chest, you do not have to listen to the chiropractic areas that we're going to cover or podiatry. However, we do cover chest, chiropractic, and podiatry. If you would like to get your license in all three, you just have to submit the proper paperwork, and we will make sure that all of it's covered. However, they are covered in different sections, and we will make sure that you get the proper training for your program licensure. If you are going for the limited chest radiography program, your training will consist mainly of the chest. The chest cavity consists of, think about when you go all the way out to your shoulder, to the top of your arm, and then come down through the chest all the way down to the diaphragm. We cannot X-ray the abdominal area. Chiropractic X-rays. It covers the lower extremities. That is your toes, feet, calcaneus, ankle, tibia and fibula, knee, patella, femur, hip and pelvis. Upper extremities, fingers, hands, wrist, forearm, elbow, humerus, shoulder, scapula, clavicle, acromioclavicular joints. The spine. Cervical spine, thoracic spine, lumbar spine, sacrum and coccyx, sacroiliac joints, and scoliosis series. For podiatry, it's knees down. Next is the specific course curriculum for medical assistants. I'm going to let you read that on your own. Also, if you are just taking the chest, you are probably moving on to the cath lab program, and that's why you have been enrolled in the CATS School of Cardiovascular Technology. And we have covered all of that course curriculum. Chiropractic technology. The next page, policies to remember. This is very important. For those of you who are studying online, you are employed by a physician or a chiropractor, and you have to follow their protocol for attendance. However, for those who are enrolled at CATS Careers School of Limited Medical Radiography, make sure you understand the attendance policy. Failure to attend 80% of the class and 95% of your clinicals, having disruptive behavior, or any other reason deemed reasonable by the instructor, we can dismiss you from the program. You must also call your medical facility and us 2 hours in advance for any absences. There are no exceptions. Failure to do so is grounds for immediate cancellation of all your clinical rotations. Attendance policy is very strict. We want to make sure that you understand that these programs are only 16 weeks long. So make sure that the third absence, you get a verbal warning, fourth absence, written warning, sixth absence, you're dismissed from the program. There is no penalty for withdrawing from the program and re-enrolling at a later date. However, just failure to attend and not following the protocol will get you dismissed, and once we dismiss you, you will not be able to re-enroll. Inclement weather. For those of you who have to drive in to our local office, just make sure you watch Wave 3. We do list our closings and our class times if we have to be delayed on Wave 3. If it's snowing, we are closed. Because we have people that are traveling from such a far distance to attend our classes, we don't want anyone on the road and have a risk of having an injury. So we do close. We will also close for schools. If the schools are closed, we're closed. Holiday schedule. We observed all the national holidays. Smoking policy. If you have to smoke anywhere at medical facilities, stay 50 feet away from all doorways. 50 feet from all doorways. And cigarette butts are to be appropriately extinguished and then put into a disposal area. Do not leave your cigarettes laying on the ground. Littering is illegal. Visitors policy, no visitors. Phone policy, all phones and pagers are to be on vibrate at all times. You are not to have phones on you at the hospital unless you are traveling, but please make sure you have them off. The hospitals do not allow us to have cell phones on. If you have to check it later, check it when you go on your break. If you have a sick child at home, have them call into the department and ask for you. They are not to contact you via cell phone. Class cancellation. If your instructor has to cancel class, your instructor will call you personally to cancel class 2 hours in advance. One phone call will be made to the daytime number listed, so make sure you have the correct number on file. Make sure you have an answering machine message because there will be one phone call made. Dress code policy. You all have received your dress code policy. Student supplies. For limited medical radiography, you're going to need scrubs, safety scissors, clean white shoes, and a lab jacket.